Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So, according to the JNC 7 criteria, JNC 7 criteria for hypertension. So, first, a person is said to have normal hypertension if the blood pressure is less than 120 by 80 millimeters of Hg. A person is said to have pre-hypertension if the blood pressure of the individual is between 120 to 120 to 139 by 80 to 89 millimeters of Hg, then we call the person has pre-hypertension. A person is said to have stage 1 hypertension if the blood pressure is 140 to 149 to 90 to 99 millimeters of Hg, then we call him as stage 1 hypertension. A patient is said to have stage 2 hypertension if the blood pressure is more than 160 by 100 millimeters of Hg, then we call it as stage 2 hypertension. So, management of hypertension based on the JNC 7 criteria. According to JNC 7 criteria, we use four drugs, that is A, B, C, D. That is A for ACE inhibitors or ARBs. Then we have B for beta blockers. Then what is C? C is calcium channel blockers. Then D is diuretics. So among all these, it is better to start with a thiazide. Diuretics is mainly used for starting for hypertension. Then actually in a patient who are younger patients, that is less than patients who are less than 55 years, in them we prefer the ACE inhibitors or ARBs with beta blockers can be preferred for patients who are less than 55 years of age. For the older patients or elderly patients who are more than 55 years of age, in them we can prefer the calcium channel blockers, and thiazide diuretics is preferred in these patients. So, any of these, all these drugs should always be initiated in the lower doses, and slowly you should increase the dose, keeping in mind the side effect of hypotension. Because if you suddenly give the uh, dose in a higher doses, then the patient might develop hypotension. If you do not increase the dose, then the hypertensive medication may not be sufficient for decreasing the blood pressure of the patient. So we should start the patient first at the lower doses and then increase the dose if the patient's blood pressure is not controlled. Even after increasing the dose also, if there is still if the blood pressure is not controlled, then you can go to the combination therapy and you can add the second drug.
thank you and thank you for watching.